This is Citizen Kelly with a very important life or death Citizen Kelly Minute. For 2 weeks, I've been fighting for my life with severe COVID pneumonia. Last week, I was in the hospital on oxygen, and at one point, I really wasn't sure if I was going to make it. I learned a lot about how hospitals are treating COVID patients, and it isn't good. Once you are COVID positive, you can't get treated anywhere but an emergency room. That's why COVID patients are flooding the ERs. There is nowhere else for them to go. This is wrong. Hospitals also don't treat COVID patients. I had a 104 temperature and was sent home with Tylenol. 2 days later, I couldn't breathe, and my x-rays showed severe COVID pneumonia. And the hospital still sent me home. In another 2 days, I had gotten even worse, and the ER doctors finally admitted me to the hospital for a week and put me on remdesivir, which probably saved my life. It's shocking. We have been suffering through this pandemic for more than a year, and the US healthcare system still refuses to treat COVID patients. Drug companies should be focused on treatment, but instead, they are making billions of dollars with vaccines. The vaccines minimize COVID symptoms, but they do not prevent infections or the spread of the virus. I have COVID antibodies now, even better immunity than a vaccinated person who hasn't been infected with COVID-19. I should not be subjected to President Biden's vaccine mandates, especially when members of Congress are exempt. Our lives, our freedoms, have been fundamentally changed by a juiced up virus that may have been created in a lab in Wuhan, funded by US tax dollars. It's time for the American people to start asking more questions about this virus, not less. This is Citizen Kelly, alive in Chicago.